What is secondary headache, and how can you tell the difference between primary and secondary headaches? Today we're going to discuss how secondary headache differs from conditions like migraine and cluster headache. A headache is considered secondary when it is caused by another condition. The term secondary is used to distinguish this type of headache from primary headache disorders like migraine, tension-type headache, or cluster headache, which just happen without any known underlying cause. Causes of secondary headaches include medical conditions, such as severe hypertension, or neurologic conditions that affect the brain and its surrounding membranes, such as meningitis. Other infections of the head and neck, including pharyngitis and sinusitis, can also cause headache. Head trauma, even if it is mild, can also often lead to headache. Anything that takes up space inside the head can cause headache, including tumors and pooling of blood, such as subdural hematomas. Thunderclap headache, a severe headache that reaches maximal intensity in under 60 seconds, can be caused by the rupture of an intracranial aneurysm, a weakened blood vessel in the brain, and the resulting internal bleeding, which is called a subarachnoid hemorrhage. Distinguishing primary from secondary headache is the most important first step in managing any headache symptoms. Some red flags that may alert your healthcare provider to a potential secondary cause of head pain include associated systemic symptoms, such as fever, sudden changes in headache frequency or characteristics, particularly in elderly patients, headaches that consistently worsen when you stand up or lie down, often referred to as positional headaches, any abnormal findings on a physical examination. Other features that may be associated with secondary headache include worst headache of your life, abrupt onset of headache without any warning or buildup, significant change in the pattern of recurrent headaches, headaches beginning earlier than 5 years old, new headaches starting after 50 years old, the presence of active cancer, the presence of HIV, new or severe headaches during pregnancy, headache associated with fever, headache associated with seizure, headache associated with medication, headache triggered by exertion, sex or valsalva, straining. Features more consistent with primary headache can include stable pattern of headache over many months or years, long-standing headache history, family history of similar headaches, headache triggered by menstruation or changes in stress levels or sleep patterns, a physical exam that shows no other issues. It's important for you to talk to your healthcare provider as soon as possible if you have concerns that your headache may be due to some other medical condition. Bring a list of any current and past medications, including over-the-counter medications, noting doses, duration of use, effectiveness, and any side effects. Ensuring there's no secondary cause is the first step toward creating an effective treatment plan that works for you.